Hello, everyone. I'm Dr. Rachana Tataria. I'm a consultant plastic surgeon, but I have a subspecialty interest into breast reconstruction as well. And here we are on a live chat at Fortis Hospital in Mulund to address any of your concerns regarding breast health and breast cancer as well. I'm pretty sure this is the March is the Women's Health Month, and as part of uh, this special month, we are running a lot of programs at the Fortis Hospital, which also includes an initiative from our Breast Care 360 Degrees, when we're giving opportunity to young and old ladies to get their breast health in check, doing including special consultations and also imaging as needed. So let's know a little bit more about breast itself is a unique identity to women, and it is a part of our dignity, our self-esteem, and it makes us whole. And we all know that women who have breast cancer do have to go through a lot of mental and physical ordeal. So a common question I'm asked often is, is breast reconstruction often necessary? So first of all, what is breast reconstruction? Reconstruction meaning, if you have to lose your breast tissue because of cancer, you don't have to, go flat. You don't have to lose a part of your body, which is a part of your whole self itself. And where, as a plastic surgeon, I'm trained to make a new breast for you. And it's very important to know that you can choose for the surgery not only even during the time of your cancer surgery, but we can also do it later in case of your finished complete treatment. So basically, coming back to breast reconstruction, why is it really necessary to do it at all? So breast reconstruction is not just purely cosmetic. It's not purely aesthetic, just to look good. The insurance companies do, cover this under your cancer insurance as well, and it is directly linked to your physical and mental health as well. So if you have one side of your breast which is missing, and the one side is quite heavy, in long term you can have some posture issues, you can have health issues, spinal issues in your spine, pain, and this can be very detrimental. So also studies have shown that women who have reconstruction are psychologically much more happier, much more satisfied to go back to their normal life, because most of us are working today, and we do not want to feel left out or feel unwhole in any manner for that matter. I do get women who are working, including your hospitality industry, be it your police, and they're concerned how are they to go back to their uniform. And this is such a simple, satisfying surgery, and it can make your you can change your life completely once if you choose to have it. So what we counsel the patients are, when they come for cancer surgery, we tell them regarding the different options they have. So if they were to have a lumpectomy, which is where they take a part of your breast tissue out, not the completely the breast tissue, the whole tissue, we can still reconstruct it. So in some patients we can get away with a smaller defect, but if you were to have a large lump in a smaller breast, it's going to leave a big defect and dent, and this can leave long term, lifelong sequelae. So what we offer them is something called as local flaps, or we share tissues from your back, the side, as needed, and we try to restore your form and shape of the breast to back to what it was. The other option is, if you were recommended by a cancer surgeon to have mastectomy, or wherein your whole of the breast tissue is removed, we offer mainly two types of breast reconstruction, which could be, one is using your breast implants, and the second would be using your own body tissues, which is also autologous breast reconstruction. So, it depends. It's quite individually tailored, and which we would offer to whom. It depends on your, body type. How is your general health? Can you tolerate a long anesthesia or not? If you are going to have radiotherapy in the future. So these are, the things that we keep in mind when offering the breast reconstruction. But I can see that more and more popular nowadays is autologous, or using your own body tissues, because this kind of reconstruction doesn't have a shelf life. ये आपको, अगर आपने एक बार ये सर्जरी कर लिया तो आपको वापस कोई मेंटेनेंस सर्जरीज करने का ज़रूरत नहीं पड़ता है। एंड इस आपके खुद के टिश्यूज़ की तरह, आपके बॉडी की तरह ये फ्लैप जो है ये बिहेव करता है कि अगर आपकी तरह ही वो एज होता है एज कम्पेयर टू द अदर साइड। एंड अगर आपने वेट पुट ऑन किया तो आपकी तरह वो वेट पुट ऑन करता है, और आपने वेट लूज किया तो आपकी तरह ही वेट लूज करता है। एंड द सेटिस्फैक्शन इज क्वाइट हाई। अगर आप रेडियोथेरेपी भी लेते हैं तो इसमें कुछ भी प्रॉब्लम नहीं आता है। इट इज़ अ वेरी वेरी एक्सलेंट रिकन्स्ट्रक्शन टू हैव। एंड नाउ डेज वर्ल्ड वाइड, वेस्टर्न कंट्रीज इंक्लूडेड, मे बी ये गोल्ड स्टैंडर्ड रिकन्स्ट्रक्शन है। So basically, as a plastic surgeon, I feel a very important part that कि मैं एक I'm trying to bridge a gap between the oncological safety and the aesthetic restoration. So cancer तो निकालना है, but वापस to get back to your normal form, your shape, and not feeling scarred for life, कि वो आप में जो एक मेन कॉन्फिडेंस है वो हमेशा के लिए लाइफ में मेंटेन रहे। क्योंकि आजकल ब्रेस्ट कैंसर का ट्रीटमेंट इतना अच्छा हो चुका है कि लेडीज दे अनदर 30-40 years जीते हैं। एंड वो आपको it doesn't make you feel incomplete at all with this kind of reconstruction. Also, coming to plastic surgery per se. So plastic surgery basically, सिर्फ cosmetic surgery नहीं होता है. It is also lot of times we do surgeries to restore form, function, and basically corrective surgeries भी रहते हैं. So let's talk about a little bit about what different kind of other breast surgeries हम कर सकते हैं. So I get women young and old who have smaller size breasts compared to your body proportion, and they're not very happy with how their breasts are looking. They look small, confidence is low. In that case, we do offer breast enlargement or breast augmentation, जिसको बोलते हैं. And we consider your wishes, your needs, कि हम काफ़ी मेजॉरिटी पेशेंट्स यही बोलते हैं कि हमको वेरी नेचुरल लुकिंग रिजल्ट्स चाहिए। मतलब कि बेसिकली हमको पता नहीं चलना चाहिए कि हमने ब्रेस्ट ऑगमेंटेशन किया है। सो ये काफ़ी ईजिली पॉसिबल है। नाउअडेज वी यूज समथिंग कॉल्ड एज गमी बेयर इम्प्लांट्स, एनाटॉमिकल इम्प्लांट्स जो आपके ब्रेस्ट के शेप के हिसाब से बनाया जाता है। And they give you a very very natural looking results as well. Whereas on the other spectrum, कभी patients आते हैं बोलते हैं कि मेरे breast काफ़ी heavy है, काफ़ी large है, and this can again be young patients and older patients as well. And the important bit to know that ये patients सिर्फ large breast से suffer नहीं करते हैं, but उनको उसके वजह से काफ़ी neck pain होना, shoulder pain होना, स्पाइन में इश्यूज होना, जो कि लॉट ऑफ देम आर मिस्ड आउट ऑन दैट। ये डायग्नोसिस उनको समझता नहीं है क्यों हो रहा है, इज बिकॉज ऑफ दैट एक्स्ट्रा बैगेज दैट दे कैरिंग विद देम ऑल द टाइम। सो ये एकदम बेसिकली सिंपल सा प्रोसीजर होता है रिडक्शन सर्जरी, जिसमें आपका साइज हम आपके फ्रेम के हिसाब से और आपके विशेस को कंसिडर करते हुए हम इसको ब्रेस्ट को साइज को रिड्यूस करते हैं। एंड ये लाइफ चेंजिंग होता है इन अ वे। और एक तीसरा तरीके का ऑपरेशन रहता है ब्रेस्ट लिफ्ट, जिसको बोलते हैं। तो लिफ्ट इज बेसिकली वी ट्राई टू लिफ्ट योर ब्रेस्ट टिश्यूज, बट आपका वॉल्यूम एडिक्वेट है, यू आर हैप्पी विद इट, एंड वी ट्राई टू मेंटेन द वॉल्यूम एट द सेम टाइम। ये वेरी कॉमनली पार्ट ऑफ मम्मी मेकओवर हो सकता है, विच इज जनरली वुमेन हु इन देयर 40s who have completed their family and they wish to उनको अपना पुराना shape वापस चाहिए, and they sorry want to regain that form of the breast before. So in that case, we would offer breast lift in these patients. A very unique problem कभी कभी मतलब anomalies, congenital anomalies या जो birth defects जिसको बोलते हैं, काफ़ी पेशेंट वैसे भी आते हैं जो it's not simply a cosmetic procedure. So I've had women coming with 2 different size of breast altogether, और ये minor size difference नहीं होता है. This can be 2 cup size, even more than that sometimes. And obviously, they are very, low in confidence. I've seen these kind of patients because they can't really wear what they want to wear. They always have to wear padded bras all the time to look similar. And it is something a developmental anomaly. So when puberty में आपका body जैसे develop होता है, ये तभी उसी time से ये difference हमको evident हो जाता है. So basically, this is also a very very correctable kind of a deformity, जिसमें हम depending on individual सब्जेक्ट के हिसाब से हम उसको एक साइड को ऑगमेंट करना है या एक साइड को रिड्यूस करना है, लिफ्ट करना है, एंड गोल होता है दोनों साइड को सिमिलर बनाना. एंड ये भी अगेन लाइफ से चेंजिंग ऑपरेशन रहता है. मोस्ट women who have this have seen a lot of difference in their confidence and their body image after having this procedure. सो और आपने अगर किसी और टाइप के ब्रेस्ट डिफॉर्मिटीज जैसे कि ट्यूबरस ब्रेस्ट सुना होगा, एक पोलन सिंड्रोम होता है जिसमें अगेन देर आर दीज काइंड ऑफ डिफॉर्मिटीज व्हिच आर देयर एंड ऑल ऑफ देम आर इक्वली करेक्टेबल. some procedures might need stages, some can be done in a single stage. किसी किसी प्रोसीजर्स को हमको अच्छे से प्लान करके जाना पड़ता है, जैसे कि आप you plan for a tailored suit or something of that sort, but all of them with good planning and all are quite will give you a very very good outcomes. So in case if you have any questions, any concerns regarding your breast health at all, if you're concerned regarding a lump into your breast, or you're not happy with the size and the shape of your breast, or you had your breast cancer surgery in the past and you're looking forward to a new reconstruction, or you have been diagnosed recently with a breast cancer and you wish to have a good reconstruction along with it, we are always here to help you. And I also want to highlight a little important tip over here, that the breast problems are not just restricted to women, they happen in men as well. So there are main two subcategories I usually get patients. So one is the benign type or the non-cancerous type, which is the gynecomastia. So gynecomastia काफी आपने सुना होगा ये word के बारे में. So it's a basically enlargement of your breast tissue in men. Generally, commonly ये आपके extremes of age में होता है. Again, during your teenage years or early 20s, when a boy is growing up under the influence of your hormones, or it can happen into 50s, 60s again, when your hormones in your body tend to change. So वो influence के अंदर काफ़ी idiopathic या without कोई reason से आपके जो limited breast tissue होता है men में, ये enlarge होता है, and this gives rise to appearance of gynecomastia. मोस्ट होता क्या, काफ़ी बार मुझे पूछा जाता है कि ये अपने आप दवाई से वगैरह से ठीक हो जाएगा क्या. सो इट्स अगर वो कुछ टाइम के बाद अगर वो सेटल नहीं हुआ है तो अनलाइकली इट इज़ गोइंग टू गो अवे विद मेडिसिन, एंड मोस्ट ऑफ देम will need surgical correction. So coffee, and most common again, I have young men coming who go to the gym very often, who are very fit, but sadly they can't wear tight fitting t-shirts, they can't go to swimming, they feel really really embarrassed about it. And this can also be addressed in a simple daycare kind of a procedure, wherein we reduce your gland tissue and do a bit of liposuction based on individual case to contour the male chest wall. So ये gynecomastia हो गया. What about cancers? A lot of you will not be knowing, but breast cancer can happen in men as well. The ratio or the incidence is quite less. अगर 99 women में breast cancer होता है तो एक मेल में breast cancer हो सकता है. So it is very important कि अगर आप especially 50s, 60s and above age के हैं, you're a man and you have a lumpy feeling in your chest area, make sure you get checked with your doctor and get it evaluated, because very rarely, but there can be breast cancer as well, and it's quite treatable. Thank you so much for your patient listening, and as I if you have any doubts or concerns regarding your breast health, please contact us here at Fortis Hospital in Mulund. Thank you so much. Thank you.